Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the National Health Care Bill is now law. What's in it? Stuart Shapiro is here, and he will analyze. Then it's Financial Education Month. Why should that matter? Pennsylvania politics and government, in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, as you know, the National Health Care Reform Bill is now law. For the next couple of months, everybody will be trying to figure out what's in it and why does that matter. As often is the case, we have our own healthcare experts. Dr. Stuart Shapiro is one of them. He's the president and CEO of the Pennsylvania Healthcare Association. He comes in, helps us analyze these complicated healthcare matters. And boy, it is kind of complicated, that bill, isn't it?
It is kind of complicated, and we've discussed this many times on this show. And the question is, and it was a very tough vote for many of the Pennsylvania legislators who had to vote on this.
Right.
Because they were asking, while it was certainly morally right for a country like ours to have health insurance for everyone. In fact, we're the only industrialized country that has not had it in the entire world. The question really is, was it worth the risk? And the risk is also a moral imperative because it's going to increase the debt over the next several years. And the question is, will it begin to bend the cost curve? Now, what's in it? There's some things that happen absolutely immediately or within the first year. People are going to not be able to be denied coverage based on whether they're sick. Right. They're not going to be able to be removed from their insurance because they are sick. Their children, who are up to age 26, will be able within the next year to enroll in the parents' policy.
Right.
Those are all very, very important provisions. There's also some very good provisions that will kick in again within the first year that will begin to give rebates on prescription drugs to the seniors. There's also pretty soon there's going to be some expanding coverage in neighborhood health centers. So there's some very positive features.
Right.
The real mandated health insurance doesn't kick in until 2014, 3 years away. And then we have to start to pay for it.
Yeah.
And that becomes the problem.
Yeah. There's sort of two or three things that are controversial. One is, to what extent will the government regulate literally health care down to the patient level as it oversees the insurance industry? And the other one is the cost. Let's go to the cost for a moment. The numbers that I've seen, and the cost of health care has never been estimated accurately, whether it's Medicare when it was first created or other expansions. So
it's always been underestimated.
Yeah, that's what I mean. I'm sorry, underestimated. The cost of this is obviously going to be a huge thing. Go ahead, talk a little bit about that.
It's going to be close to $1 trillion over the next decade, so they're predicting now.
Right.
That presumes that part of it's going to be paid for with $500 billion of Medicare cuts. Whether that will ever happen, I don't know.
Well, hold on a minute. Now, with senior citizens, 75 million people beginning in 2007 going to, the next 25 years, Doctor, going to be 75 politically. Can you cut I mean, you've been following this for a long time.
Absolutely.
Can you cut Medicare?
I don't think you can safely cut Medicare to the dollar values that are in that legislation. They're also paying for this by, it's in the bill, it happens in 2018, is when they begin to tax high cost plans.
Yeah.
And whether that's going to ever happen, the tendency is always to put this off.
Yep.
So while we have the great moral imperative, the good, the positive, of covering 32 million people, and many of them need this coverage desperately.
And let me just stop you right here. I mean, in all the polls that have been done, the citizens of the country rightfully support the notion of covering Americans. It's how we do it that's in this debate. Am I right or wrong
Absolutely.
about that?
And whether we can do it right now.
Yeah.
And then the things that aren't in this bill
yeah.
that hopefully will get fixed over the next year or two or three, and that's some tort reform.
Yeah.
So they'll give the providers of care some protections when they do what's right from having to just do repeated tests to try to protect themselves.
I mean, look, in addition to what you do, you're a real expert on Medicare and Medicaid programs. You know how they function. You represent, folks who obviously require the payment for those, or your facilities couldn't even am I right? You couldn't even operate without these.
Well,
I mean, these people go ahead.
Let me tell you what's happened in Massachusetts, because I think it reflects on that. They passed health care reform 3 years ago. The costs have gone up 50%. They predicted that emergency room visits would go down by 75%, but in fact, emergency room costs have gone up 17%. And hospitals, which have a lot more people covered, so they don't have the uninsured, are under-reimbursed and are on the verge, many of them, of bankruptcy, so they're now suing the state of Massachusetts. We depend, all providers, in order to provide the kind of care that people want, Medicare and Medicaid. Medicaid doesn't cover the full cost. Medicare pays very adequately, and it compensates for those that are on Medicaid. So if you try to take dollars out of Medicare, you're going to run into real problems.
And the other thing is here's what I understand, and we're going to go to break. But the private insurance market, because Medicaid operates at a loss, so the private insurance market funds the underpayment for Medicaid for lots of facilities. Am I right or wrong?
It does for hospitals. It doesn't for hospitals, but not for nursing homes. It does for doctors, but not for nursing homes. And that's why the nursing homes have such a challenge in caring for the elderly in Pennsylvania
and boy, if
today.
anything, we're going to run to a break, but there's going to be a huge amount of pressure on your facilities with people getting older. They can't, everybody sort of wants to take care of folks in their home, in their house, but at some point you can't do that. I mean, for some people, not all people, right or wrong.
Those are the challenges we'll talk about after the break.
All right, we're going to break. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.